Hey everyone, and welcome back. Today, we're jumping into something that is, without a doubt, one of the most critical skills in neonatal care: positive pressure ventilation. When a newborn is struggling to take that very first breath, this is the procedure that can literally make all the difference. So, let's get straight to it. Okay, let's kick things off with the absolute number one most important principle. Right here on the screen. Lung ventilation is the most important step of resuscitation. And I mean the most important. If you can get this one thing right, you're going to solve most of your problems before they even have a chance to get worse. Everything else, compressions, meds, that all comes later, if you even need it. So here's our game plan. First, we'll talk about why ventilation is so incredibly powerful. Then we'll get into the tools of the trade, the right technique, and how to know if you're actually succeeding. We'll also cover your emergency backup plan, the amazing MSOPia, for when things aren't going right. And then we'll briefly touch on what comes next. Right, so let's dig into that core idea, lung ventilation. What makes this one step such a powerhouse? Well, it's because in newborns, the problem is almost never the heart, like it is in adults. It's almost always about breathing, about making that huge transition from the womb to the outside world. And that's really the key takeaway here. If you can get air into the lungs, you fix the main problem. The heart rate comes up, oxygen levels get better, and more often than not, that's all it takes. Seriously, you'll rarely need to go to more advanced steps if you just nail effective ventilation from the very beginning. All right, let's talk tools. At the bedside, you're usually looking at two main options: the classic self-inflating bag, the ambu bag, and the T-piece resuscitator. Knowing the difference between them, and more importantly, which one to grab in the heat of the moment, is a really big deal. So what's the real difference between these two? Well, it all boils down to one word: consistency. With that ambu bag, the pressure you're giving that baby, it completely depends on how hard you squeeze it. So one breath could be 20, the next one might be 26, it's all over the place. But the T-piece, it's a game changer. It delivers the exact pressure you set it to, every single breath. And, this is huge, it also gives you consistent PEEP. That's positive end expiratory pressure, which is what keeps those tiny little air sacs from collapsing after each breath. Super, super important. In that consistency, that's exactly why the T-piece is the go-to for preterm babies. Think about it. Their lungs, their brain's blood vessels, they are so incredibly fragile. Big swings in pressure from an ambu bag can actually cause lung damage or even brain bleeds. The T-piece provides this gentle, consistent pressure that's just so much safer for them. Now, listen up, because this is a massive safety warning. A standard self-inflating bag only pushes air when you squeeze it. If you just hold that mask on a baby's face thinking you're giving them oxygen, you're not. In fact, if you've got a tight seal, you could actually be suffocating them. It's a common mistake, and it is incredibly dangerous. Okay, so we know why we do it, and we know what we do it with. Now let's get down to brass tacks, the when and the how of actually starting positive pressure ventilation, or PPV. So what's the signal? What's that one clinical sign that just screams at you, okay, it's time to start PPV and we need to do it right now? This is it. This is your magic number, a heart rate below 100. It is the single most important indicator you have. It tells you when to start, and as we'll see, it tells you if what you're doing is working. So just to be crystal clear, there are three main triggers for starting PPV. Number one, that heart rate below 100. Number two, if the baby isn't breathing at all, they're apneic, or they're just gasping. And number three, if their oxygen levels stay low, even with other support like CPAP. Any one of those and you're good to go. And what's the goal? What's your rate? You're aiming for 40 to 60 breaths every minute. Why? Because you're basically trying to mimic the natural, healthy breathing rhythm of a brand new baby. Now, how do you keep that pace when the adrenaline is pumping? The easiest way is this simple rhythm. Just say it out loud or in your head. Breathe, 2, 3. Breathe, 2, 3. That cadence will naturally land you right in that sweet spot of 40 to 60 breaths a minute. It's a lifesaver for staying calm and consistent. So you've started. The room is quiet, everyone's focused. How in the world do you know if it's actually working? You have to figure this out fast, because literally every single second is critical. Look for two things. The number one absolute best sign of success is a rising heart rate. If that heart rate climbs from 80 up to 110, you are winning. That is your primary indicator. The second thing you need to see is a gentle, visible rise and fall of the chest with every single breath you give. Now you've got to move fast. The second you start PPV, an internal 30-second clock should start ticking. After just 15 seconds, you have to look for that chest rise. If you don't see it, you cannot wait around. You have to start troubleshooting immediately. Then, at the 30-second mark, you check that heart rate again. Has it gone up? But what happens if at that 15-second check, the chest is flat, the heart rate isn't budging? You need a rescue plan. And that's where the incredible mnemonic MRSOPA comes in. It is your step-by-step guide to fixing this problem right now. So you're in that exact spot. You're giving breaths, but you see nothing. The chest is still. Okay, this is not the time to panic. It's time to run the checklist. It's time for MRSOPA. Mr. SOPA is your roadmap here. It's a beautiful, logical flow that takes you from the simplest fix to the most complex. First up, M, for mask adjustment. Get a better seal. Still no chest rise? All right, move on. R, for reposition the airway. Get that head into a better position. Try again. Still nothing? Okay, next step. S, for suction. Clear out the mouth and nose. Then O, for open the mouth. Sometimes it's that simple. If you're still not getting anywhere, now you can think about P for increasing the pressure. And if all of that fails, and only then, do you go to A for an alternative airway. That last letter in our rescue plan, A for alternative airway, brings us to the next level. This is for those pretty rare but absolutely critical times when you just cannot get good ventilation with a mask no matter what you do. Your two big options here are an endotracheal tube, the ETT, and a laryngeal mask airway, the LMA. Now, the ETT is considered the definitive airway. It goes right down into the trachea, but it takes a lot more skill and training. The LMA, on the other hand, is way simpler and faster to put in. It sits just above the voice box, and it's a fantastic rescue device if intubation is taking too long or just isn't working. Okay, let's say you've done it. You've placed an advanced airway. The baby started looking better. But then, all of a sudden, things go south again. What do? Just remember the mnemonic DOPE. Is the tube displaced? Is it obstructed with gunk? Has the baby developed a pneumothorax, a collapsed lung? Or is it something simple like equipment failure? It's a quick and dirty checklist to find the problem fast. And that really brings us to the final and maybe most important point. Knowing all the steps is one thing, but being able to execute them flawlessly under pressure? That comes down to teamwork, to communication, and to practice, practice, practice. So the question I want to leave you with is this. Is your team truly ready for when that moment comes? Because in the end, preparation is everything. Thanks for joining us.